If you are finding yourself in a seemingly never-ending need to wipe after you poop, there are several reasons why this might be occurring. My name is Dr. Brooke Kolisiak. I am a pelvic physical therapist who is passionate about helping people optimize their pelvic health. And today we're going to be talking about why you might feel the need to wipe and never feel clean. There can be many causes to feeling like you're not getting clean. One of them might be incomplete evacuation. So if you are not fully emptying your bowels when you sit down to poop, it can feel like you may need to wipe but never get clean. There are several factors that can contribute to incomplete evacuation. There can be dietary issues, hydration issues, even stress responses or pelvic floor muscle function issues, and we're going to talk about these a little bit more. Dietary issues can play a significant role in whether or not you are emptying your bowels all the way. So if you have a diet that is low in fiber and high in processed food, which is really common in the American public, this can lead to really soft stools, or even on the flip side of it, constipation, and not feeling like we're fully able to evacuate. So evaluating your fiber intake, your goal is to be getting at least 25 grams of fiber a day, and then seeing if we need to increase that fiber amount is something that can be really helpful when people are dealing with this incomplete evacuation. I highly recommend tracking your fiber first before just trying to increase it, because when we just kind of randomly increase it, you can definitely end up with bloating and discomfort. So track how much fiber you're taking in first, and then slowly increase it by a couple grams each week to let your body get used to it. And when you increase fiber, you also need to think about increasing water. We need both of those to increase because the fiber helps to absorb the water into the bowel movements to make sure that the fecal matter, the poop, is a nice, soft formed log. And if the water is not there, but we increase fiber, that can lead to a lot of bloating and discomfort. So dietarily, you want to think about, are you eating high fiber, low processed foods, as well as are you getting in enough hydration? If not, those are things that you can start to change right away to see if that has an effect on whether or not you are evacuating your bowels all the way. Another thing that can contribute to not feeling clean after wiping is pelvic floor dysfunction. Your pelvic floor muscles create a sphincter around the anus, and if they are not working correctly, we can have trouble fully evacuating our bowels, or feeling like that anus can kind of pucker and close back up afterwards. So the dysfunction of the pelvic floor muscles can be either that the muscles are too tight and tense and not allowing things to come out all the way, or the muscles are perhaps too weak and not allowing for that closure of the anus afterwards. And if there's any fecal matter remaining in the anal canal, you're going to get that when you can wipe. So being evaluated to see what your pelvic floor muscles are doing to see if they're dysfunctional can be a great first step to make sure that you are not having this feeling of incomplete emptying or feeling like you're not able to get clean after a bowel movement. A final thing that may contribute to that incomplete emptying or feeling like you can't get clean are the presence of anal fissures or hemorrhoids. Fissures are little cracks in the wall there, and poop can kind of sneak into those little cracks and not feel like it kind of comes out all the way. And it also can make the tissue feel really inflamed and irritated. Hemorrhoids are where we've got an inflamed and swollen blood vessel in the area, and that can be either internal in the anal canal or right on the outside. And this can kind of create some blockages or places where, kind of disrupts how the poop comes out of the anus. And so when you go to wipe, some might be left behind or sticking around there. So if you're dealing with anal fissures or hemorrhoids, it's good to talk with your doctor about these and seeing what type of medical management can be there to help so that you can completely empty and you feel like you can get clean when you wipe. Pelvic physical therapy can be super helpful for those people who are unable to feel like they can get completely clean after having a bowel movement and feel like they just have to wipe. A pelvic physical therapist can evaluate to see if you're dealing with pelvic floor muscle dysfunction, especially those muscles called the external anal sphincter, right around the anus there, to see if those muscles are too weak or too tense. They can prescribe exercises to help strengthen the pelvic floor if need be, or to help get them to relax and stretch if need be. A pelvic physical therapist might also do some type of manual therapy techniques to help stretch and relax muscle if that needs to help happen to make sure that you can have a good bowel movement. We also do a ton of education on lifestyle and dietary changes so that you can make sure that the consistency of the bowel movement is good. Remember, we're going for a nice soft log. We also can work on ways to create the push to have a bowel movement and proper positioning on the toilet, and moves you can do to help make sure that you're evacuating fully. So if you're dealing with this feeling of incomplete emptying or feeling like you can never get clean after a bowel movement, partnering with a pelvic PT might be your best next step.